As the students head back to school, parents may be wondering whether their child should get the COVID vaccine. While federal officials in the U.S. say the vaccines remain available to everyone, new guidelines released this week could limit access to the shot this year. Jen Sullivan breaks down the controversial decision.
This year's COVID-19 vaccines have been approved by the U.S. Food and Drug Administration for adults 65 and older and younger people with certain medical conditions. Until now, COVID vaccines were available to anyone 6 months and older.
The FDA's decision does not affect the availability of COVID vaccines for Americans who want them.
But the decision is sparking outrage from many health professionals.
We have entered a dangerous time for U.S. health and security.
The president of the American Academy of Pediatrics saying in part, as we enter respiratory virus season, any barrier to COVID-19 vaccination creates a dangerous vulnerability for children and their families. Many are wondering if the decision was political. U.S. Health and Human Services Secretary Robert F. Kennedy Jr. has long said he wants to end COVID mandates.
There is an attempt to retrofit data to actually support policy decisions that were not come to through any scientific process.
Dr. Dimitri Daskalakis and 3 other senior officials resigned from the CDC this week, following several tumultuous months for the health agency, including staff reductions, budget cuts, a recent shooting at CDC headquarters, and the latest, the new director, Dr. Susan Manares, fired by the White House after less than a month on the job.
We're not prepared for that next outbreak. We were, but we're not right now.
This map shows the most recent CDC data of the wastewater viral activity levels of the virus that causes COVID-19. The darker blues indicate higher viral activity levels. All of this coming as students return to school and the start of flu season around the corner. I'm Jen Sullivan reporting.